Everybody hear me okay? Great. Well, please everybody take their seats. My name's Elliot Menschik. I lead the healthcare arm of DreamIt Ventures, and I'm delighted to be your host for today's program, which is the inaugural demo day for DreamIt Health. Before we kick things off, there's a few housekeeping items I'd like to cover. Number one, we'd encourage you to tweet, and when you do so, please use the hashtag DreamItHealth. Second, probably the most convenient way to reach any of the founders you're going to hear from today is a standard email address they've all set up, which is founders@companyname.com. A few of them may actually be .org. And the third, we encourage you to download, if you haven't already, the DreamIt Health app, which is really a beautiful digital guide to all the companies you're going to hear from today. So this is live for iOS devices in the Apple App Store. Many of you have come from quite a distance to be with us today, and thank you. And I want to welcome you all to the epicenter of healthcare innovation. Within 100 miles of where we are today is the densest group of healthcare resources anywhere in the country. I came here 20 years ago to go to medical school, like a lot of other people, and like some of the folks you're going to hear from today, ultimately left medicine to launch a healthcare startup. We grew that company here in Philadelphia in the city, and then we successfully sold it to one of the largest Blue Cross Blue Shield organizations in the country. And I'd argue that there's really no better place to launch your healthcare startup than where we are today. Everywhere you turn, you have world-class providers. You have market-leading payers, global biopharmaceutical companies, and industry titans who all call this home. And growing up around them are the next generation of upstarts. Some of them are providing services and collaborating with the incumbents. Some of them are competing with those incumbents. All of them are focused on creating lasting value, solving significant problems in what's a $3 trillion industry. Some of them have had some significant exits, even just in recent years. For the last 250 years, Philadelphia has been the center of healthcare innovation. And that's memorialized in this famous painting by Thomas Eakins, the Agnew Clinic, which hangs just a few blocks from here at my alma mater, Penn Med, the first school of medicine in the United States. Philadelphia is also home to the first hospital, the first children's hospital, the first college of pharmacy. There are many firsts. It's been home to birthing new vaccines, new treatments, new procedures, new diagnostics, new software, new services, and the 10 companies you're going to hear from today carry on this tradition. And what powers their ability to do so are two exceptional organizations, Independence Blue Cross and Penn Medicine. And so it's my great pleasure to introduce you to Dan Hilferty, the CEO of IBC, and Ralph Muller, the CEO of Penn Medicine.
Thank you, Elliot, and good morning, everyone. How exciting is this? Here we are in Philadelphia. Elliot talked about the great history we have, the wealth of healthcare and innovation and science knowledge that we have right here in the Delaware Valley. And so on behalf of Independence Blue Cross, I want to say thank you to Elliot and the entire team at DreamIt Health, and also to my friend and colleague Ralph Muller and everything that Penn Medicine and the University of Pennsylvania does for this great region. Thank you. And now I'd like to thank each and every one of you for being here today. You see, at Independence Blue Cross, we have a dream. We have a dream that we'd like to be recognized as the best blue plan by 2016. And in order to do that, in order to serve our members in the best possible way, we realize we need to focus on innovative ways to truly manage care, truly manage populations, truly find ways to be more cost-effective and drive up the quality of care in our region. So to be part of this group that brings some of the most innovative thinkers from around the country right here to Philadelphia, right here in the Cradle of Liberty, to enter a boot camp, accelerate their business, I believe it will be an opportunity to accelerate the Philadelphia region. Why can't we be the Silicon Valley of healthcare innovation? We have government that's behind it. We have the science centers along Market Street. We have great healthcare institutions, starting with Penn Medicine. And we have a business community that is ready and willing to open our arms and make Philadelphia the place where people want to come and create innovative ideas that do what I said: drive quality, drive down cost, and make it easier for people to stay healthy. So thank you very much for having us. I look forward to watching the results of the boot camp, and I pledge to you that Independence Blue Cross, through our Center for Healthcare Innovation, will be a partner with anyone that's willing to come to Philadelphia, investigate, and come up with ideas that help us be the best blue insurer in the country. So thank you very much. Have a great conference.
Well, let me add my welcome and thanks to you as well. You've heard the themes from Elliot and from Dan. And as you can tell, this is a setting where Penn Medicine always meets. You know, this is a great place here with the music and so forth. In fact, those who are not familiar with this place, last time here I saw the Ronettes performing, and I must say, some of you probably don't even know who the Ronettes are, but my vintage knows who they are. And it's a great setting to be here and look up and look out as you as well. As Dan and Elliot emphasized, it's great to have you all here together. The kind of partnerships that are expressed both between Blue Cross and Penn being here, but also when you kind of see the morning headlines about the House trying to undo Obamacare and so forth, and contrast it to what you're all trying to do here, which is advanced medicine for the populations both here and nationally. And part of what's exciting, and I look forward to the next round of presentations, I was there to hear some of it a couple of months ago, is the fact that you're all thinking about how to put the patient at the center of all this. I think we all know from our loved ones, even for those of us who work inside of healthcare, how complex the healthcare system is on all fronts, and how it's really obligatory for all of us to kind of figure out how to make it easier. We can't have this whole population, the baby boomers are aging into Medicare, the patients are going to come onto insurance as a result of the Affordable Care Act. We can't have all these people constantly trying to figure out how to access this system. So the kind of innovations that you're presenting today, I think are going to help those kind of people go forth. It doesn't happen in a moment, but this kind of innovation that Dan and Elliot spoke about is so critical to our future as well. It's also exciting to see the energy, not the buzz in the hallway as we came in here. And part of what you see expressed here in these processes is your perseverance. You know, whether you go back to the history of how Ben Franklin and the other founders created both Penn and a lot of what goes on in Philadelphia and beyond, it's that ability to persevere and keep going at it. And these companies that are presenting today have that kind of ability to do so. So much of what it takes to change any complex organization such as healthcare in this country is the ability to have leaders focus together on how to make things work. A lot of people have ideas. Implementing those ideas is much more difficult. And part of what you see in any startup company or any successful company, and you heard Dan express some of the dreams that IBC has, and we can speak to what Penn Medicine wants to do as well, is really that opportunity to put creative people together, have them persevere, keep working through the kind of issues that are difficult to solve. Anybody can have an initial idea. Very few people can take it through to execution. So I look forward to hearing more of that from all of you today. I think the excitement in the room is great. And I look forward to having more events here. This is a much better place than we usually meet. But I really want to thank the energy of all of you. I think this means a lot to the region. And I think we'll keep looking forth to the kind of innovation that we're committed to. I want to personally thank, not just the DreamIt people that Elliot and Dan have already spoken about, but my colleagues, Roy and David and Bill at Penn Medicine have done such a critical job in bringing this day forward. It takes a lot to make these events happen. I appreciate them personally for what they've done. So let's listen to all of it.